I thank our chairman and our leader on this issue. Would you yield the?
I yield to my colleague from Iowa.
I appreciate
talk
that.
About this.
I thought I first, Senator Dodd. I thought I first, I heard all this talk about socialized medicine. These are scare tactics. There's a lot of scare tactics going on. I was in my state over the weekend, and people were talking about how we put euthanasia in the bill, and we put all this crazy stuff going on out there. And I got to thinking about this, and there's a lot of money on the table. We spend, $2.3 trillion a year, if I'm not mistaken. There's a lot of money out there, and there's a lot of people who have a vested interest in not changing this system because they're making a lot of money. Well, obviously what they're trying to do is scare people. Change. People elected us, I think, and elected President Obama to make some changes in the way we do things. But there's a lot of vested interests out there that don't want to change. So I think there's a lot of scare tactics and stuff going out there. They're just unduly scaring people. And obviously by people that don't want to change the system. They love the status quo. The other thing I might just say is that all this talk about socialized medicine, historically, when President Harry Truman first proposed a kind of a national health insurance program, that's the issue that was raised in 1951. I think it was 1950. I could be off a year, maybe 50 or 51. It was raised when he was proposing this. And the origins go back to an individual whose name I just forgot right now, but was an advertising executive, and was hired by the AMA at that time to stop the Harry Truman's program. And so he came up with, and he coined this whole phrase, socialized medicine. And it was picked up then by Senator Robert Taft at that time, who picked it up and kept harping on how the Truman program was socialized medicine. Well, that was 1949, 1950, I think it was. And here we are all these many years later, and we hear the same arguments coming up again. It wasn't socialized medicine then, and it's not socialized medicine now. What it is, as my leader knows, is we're trying to get a system that is stable, that people rely on, that they know it's going to be there for them. It's affordable, and gives them a quality health program, as you said, Senator Dodd, just like we got. And that's what we're trying to get the American people, the same kind of a system that all federal employees, and we're on the same system as your local postal employee in a small town in Connecticut or a small town in Iowa or somebody that works for the Farm Service Agency or the federal government. We all are in the same plan. And we have a lot of choices, don't we? I mean, every year I think we get 20-some plans we get to pick from. So we sort of have like an exchange out there where every year we can go on there, and if we don't like what we got, we can go to something else. Why shouldn't the rest of the American people have that kind of an access? I spoke with a small businessman in Iowa last week. He has 12 employees. Spends 15% of his gross revenues on health care. He had 12 employees. One of his employees had a kidney transplant. Another came down with cancer. And in 2 years, his insurance premiums went up 100% in 2 years. Now, he has a $5,000 deductible. And he said he needs some work done. He wanted to go in for a colonoscopy because he just turned 50. Colonoscopy costs $3,000. Well, that's out of pocket because he has a $5,000 deductible. And that's as I'm kind of getting to my point on prevention here. But we know that if he has a colonoscopy early and anything happens, you can stop it. It's one of the most preventable forms of cancer is colon cancer. Yet it's one of the most deadly if you don't get it in time. So I asked Art, I said, why don't you get a different plan? And he said, I can't. I only got one in rural Iowa. I only got one plan I can go to. Well, what we're trying to do is to get more plans out there for people in small towns in Iowa and Connecticut and everywhere else so they don't have to be stuck with one plan. They can shop around and get other plans. And he asked me if he could get on the public option plan that we have in our bill. And I said, sure. For small businesses like you, absolutely. That means he can get in a pool with everybody else around the country and reduce his costs. So I just remembered that. And I remembered him talking about trying to get a colonoscopy. And this kind of gets to this is sort of the nub of what I wanted to talk about here briefly, and that is the focus on keeping people healthy. President Obama said it very clearly when he addressed a joint session of Congress earlier this year. He said, We have to make a major investment in prevention and wellness, because that's the only way we're going to keep people healthy and reduce medical costs. Well, President Obama gets it. He understands that we have to make a major new investment. And that's what we have done in our bill. Our Affordable Health Choices Act that you led so greatly through our committee, Senator Dodd, we make a major, major investment in prevention and keeping people healthy. And you're right, I started saying we have a sick care system, not a health care system. I started saying that in 1992, that we have a sick care system, not a health care system. If you get sick, you get care, one way or the other. But there's not much there to try to keep you healthy in the first place and to focus on prevention. Now, again, our bill has a very strong provision in it. And just some ideas on what we've tried to do. The real health reform, I said, starts with prevention. It really does. If we don't do prevention and wellness, you can jiggle the payment system all you want, and you're not going to save a dime unless we start focusing on keeping people healthy in the first place. Now, is there support for that out there? Sure. American people get it. They understand this. They were asked, should we invest more or not invest more in prevention and wellness? Well, you can see 76% of the American people said we had to invest somewhat or strongly. Invest more, 53%. Invest somewhat, 76%. Not investing more, 10 to 16%. So American people, they get it. They get it. You can talk to anyone you want about health care and ask them, would you rather just have something that takes care of you when you get sick, or would you rather have more focus on keeping you healthy? And I'll tell you, the response will be, I want to stay healthy. People want to stay healthy. But in a lot of cases, they don't know how, and there's not the support systems there to do that. Now, again, on saving money, a lot of times we hear that this won't save money, and the CBO, the Congressional Budget Office, doesn't score it. Well, we asked the voters in a poll, will prevention and wellness save us money? 77% said yes. Yes, it will save us money. Again, the American people get it, that we've got to focus more on prevention and health. Now, we have some problems with CBO. That's the Congressional Budget Office, for those who are not don't understand the jargon around there. The Congressional Budget Office doesn't score us very well. Score means they don't give us much savings when we invest in prevention and wellness. Well, I've gone over that with the Congressional Budget Office, and the problem is they don't give us savings because they don't give savings on what they call secondary savings. Secondary savings. Well, that's what prevention is. It saves you money from going to the hospital or getting sick. But they don't give us a good score for that on savings. But do we have data? Do we know if it saves money? Sure we do. Here, this was just from the Trust for America's Health, did a big survey of community-based interventions, and for $10 a person, in 1 to 2 years they saved $2.8 billion, 5 years $16.5 billion, 10 years $18.5 billion. That's just $10 a person, and that's just in community wellness programs. And so we address the whole gamut in our bill. We address the community-based wellness programs and the clinical-based. For example, what we do in our bill is we set up an investment fund to do a number of different things. Let me just give one example. We are going to train health professionals in how to work with pre-diabetic individuals, people who have tested high, who look like they're pre-diabetic, to work with them to manage their condition, to get them on the proper diet, to manage them as they go along. Well, now, what's so important about that? Well, what's important about that right now is that, for example, in Medicare will pay $30,000 to amputate your foot if you got diabetes. They won't reimburse 1 cent for nutrition counseling before, so you don't get diabetes. But they'll pay for nutrition counseling after you get diabetes. Now, that doesn't make any sense. Right now, the cost of diabetes in our society is $174 billion a year on diabetes. $174 billion a year. Well, it doesn't take a genius to figure out that if we can get a hold of people who test pre-diabetic and get them on a program, and a well-managed program, so they don't come down with diabetes, you're going to save money. Congressional Budget Office doesn't score that as any savings. So on the clinical level, we'll do that. We'll reimburse, for example. There will be a reimbursement for cancer screenings, for smoking cessation, nutrition counseling, colorectal screening. There'll be reimbursements for that, and you won't have to pay any deductibles or copays. So my friend in Iowa who was now facing $3,000 for colorectal screening, this will not cost him anything. No copays, no deductibles, and insurance has to reimburse for it. Now again, if we catch these things early, it's just like mammogram screening. We know that if we get breast cancer early, it's curable. And again, I can say something here that's public. The mayor of Cedar Rapids, a woman, I was in Iowa this weekend. It was announced that she has breast cancer. She went in today for a small surgery. She'll be back at work tomorrow because they got it early.
My colleague with you.
Yes.
And I'm I guess Exhibit A. I've got my annual physical this year. And my annual physical, my PSA score spiked, shot up.
Sure.
That was a signal to the doctors that maybe something more serious is happening.
Right.
They decided a biopsy was appropriate. The biopsy showed I had cancer. But I had the annual physical, which my health care plan pays for. If you don't have health care, that physical can be very expensive.
That's right.
So people don't get their annual physical.
Exactly right.
Prostate cancer is the slowest form of cancer in growing. It's the easiest to manage. If you got to have cancer, it's the best one to have. Not that you ever want to have any cancer, but if you got to have one, that's the best one to have.
Yeah.
If you catch it early. A number of our colleagues here have had prostate cancer. But the way to deal with it, as you point out, is if you get that screening, you have the opportunity to get that annual physical, you detect it early, then I'm going to be able to deal with this, and I'm told I'm going to have a very healthy life for many more years to come.
Absolutely.
If I went years without detecting this,
That's right.
and it migrated and metastasized into my lymph glands or into my bones or whatever else it may go, I could be in serious trouble. Spark Matsunaga, our former colleague from Hawaii, died of prostate cancer. John Kerry, our colleague, his dad died of prostate cancer. 30,000 people a year die from prostate cancer. Not because they caught it too early, because they never caught it. And that's what screening does. And so that's why what you're saying is such value.
I appreciate the senator saying that. That's why we have to put more focus on this prevention and getting people in for early screenings. Again, if you get it early, you're cured. Yeah. We know that, and so we want to remove any of the obstacles that people have for going in and getting screening. Now, again, Congressional Budget Office says, well, they can't figure out the savings. Well, I said, why don't you go look at Pitney Bowes, a big company, 200 and some thousand employees scattered all over the United States,
headquartered in Connecticut.
Oh, I did not know that, Senator Dodd. Okay, good. All right, that I didn't know. But Pitney Bowes and their CEO, Mike Critelli, went on a big program of wellness and prevention for all their employees. I think they called it Healthcare University or something like that. And here's what they found. They found that through their wellness and prevention program, they reduced their number of hospitalizations for all their people by 38%. 38%. Think of the savings. They reduced their disability payments and claims by 50%. By 50%. Just through their wellness and prevention program. So, again, this will save us money, and it'll make people healthier. Not only that, I say to my friend, it's just the productivity level. People will work harder, they'll work better when they're healthy and they're well. But one other thing I just want to mention, we have a trust fund. We have a fund in the prevention title of the bill that will increase over the years to a significant amount of money. And people say, well, what's you going to use that money for? Well, right now, the Center for Disease Control and Prevention, for cardiovascular disease prevention, heart disease prevention, the current funding is $50 million for all states. $50 million. That's barely enough to even print a pamphlet, get information out to people. $50 million for cardiovascular disease. And yet, just on angioplasties alone and bypasses, we spend over $90 billion a year just on those two items. But if they're caught early, and if there are prevention programs out there, we can cut those down. I mentioned diabetes. Right now, I said diabetes costs us $174 billion a year for diabetes. So, the current funding is $62 million a year for diabetes prevention and control in the entire United States. In the entire United States. Arthritis. Current funding is $13 million. For nutrition, physical activity, and obesity, right now, $42 million is all we spend through the Center for Disease Control and Prevention. $42 million a year. Well, you get my point. My point is that we are not focusing enough on prevention and wellness, and that's what this bill does. And I thank our chairman. I thank Senator Dodd. I thank you for your great leadership on this. I think that's what people have to understand, that in our bill, we have defined what we want to do on prevention and wellness. And quite frankly, I think we had good support on both sides of the aisle for that. I think the American people support putting more emphasis on keeping people healthy. Andrew Weil, Dr. Andrew Weil, by the way, has come out with a new book, Why Our Health Matters. And one of the things that Andrew Weil pointed out to me a long time ago is he said, you know, it's the natural state of the human body to want to be healthy. It's in our DNA. Our body wants to be healthy. And yet, everything we do kind of lends itself to be unhealthy. We have to make it easier to be healthier and harder to be unhealthy. Right now, we have just the opposite. It's easy to be unhealthy and hard to be healthy. Especially when you find you have to make all these co-pays and deductibles, and there's not much out there. If you're pre-diabetic, where do you go to get the kind of counseling and help you need so you don't get diabetes? Well, I suppose if you got a lot of money, you could probably do it. But for the average person out there, they have no idea where to go. Lastly, I might mention, Senator Dodd, that also in our provision we have, and we hope we get some more in other bills, but workplace wellness programs to buttress what Pitney Bowes and Safeway and others have done in workplace wellness. So I'll tell you, I think for this bill, it's key. It is just key to reducing costs and changing sort of the structure of health care in America. And so I'm just grateful to you, Senator Dodd, for your leadership in pulling this together and making sure that in this bill we have a very strong investment in prevention and wellness.
I thank my colleague, and before I turn to Senator Brown and Senator Whitehouse, and there are a lot of things to talk about in the work that Senator Harkin and the committee did on prevention. But one of the great successes in this bill was a matter he worked out with our friend and colleague from New Hampshire, Judd Gregg. And you mentioned Pitney Bowes and you mentioned Safeway, Mr. President. And the presiding officer is, of course, a member of our committee as well and will recall this conversation. But the amendment that we worked out will allow for companies to reduce by as much as 50% the premium cost of employees who decide to take the personal responsibility of improving their health care, getting involved in smoking cessation programs. Those who can lose weight will go on programs to take that poundage off. I'll never forget Stephen Bird, the CEO of Safeway, telling us that for every pound a person who could lose weight loses in a year is a $50 savings in premium costs for every 1 pound. So you just think about what that can mean in terms of not only a healthier employee, but also bringing down that cost of health care. Not to mention, of course, that person less likely to contract diabetes or related problems. So you get a cost savings, you get a healthier person, you get a more productive worker, and that language exists in this bill because of what Tom Harkin did with Judd Gregg on a bipartisan basis to make this a better and a stronger bill. And I commend you and thank you for it.